I'm Claudine Wong, joining you from the San Francisco Bay Area from KTVU, and I'm joined now by two guests. We've got Tom Mascal, who is the partner in charge of consulting, and Dean Piambo, who is the chief relationship partner at Armanino. And you guys are a business consulting CPA firm. Tell me about what your clients are telling you in this COVID time right now. It's a hard time to navigate.
Yeah, I think, our clients are obviously focused on keeping their business as healthy as possible. First and foremost, their concern goes to their employees and the employee base. But real quickly after that is, are we going to survive as a business? How are we going to survive as a business? What should we be doing? Virtually every one of our clients has sent all their employees home to work.
Mm-hmm.
And that was an immediate challenge for companies, which is, are we prepared technologically? Do we have the right cloud technologies? Are our employees going to be productive working at home? And certainly that was, a big priority over the last month and a half. And that has now pivoted to, hey, maybe we're going to be coming back to work pretty soon. As states start opening up, as, businesses start focusing on what's the next phase, really understanding what should we be doing with our employees? How should we be getting back to work?
Well, we hear that term new normal. We hear a lot of terms over and over again, but clearly when we come back, I think what everyone has understood, in the first couple of weeks, everyone's like, okay, for first 2 or 3 weeks, we'll just shut down and then we'll come back and we'll get through this. And there was a lot of that talk. And now it's been, okay, well, this dynamic situation that we're in is constantly changing. So now we have to reimagine. We are reinventing the wheel in some respects, I think, as we're hearing from people in different industries saying, we're planning, I used to joke that, a great idea on Monday sounded absolutely ridiculous on Wednesday. And I think businesses are seeing what they did 3 months ago in January seems like a crazy way to reintroduce themselves to the world of their clients now.
Yeah, absolutely. I think it's a moving target for companies, and there's a lot of information that's out there from various sources. And from a business perspective, I think there was just a general frustration early on that the data that was coming out from a COVID perspective was more health oriented, rightly so. It was about the rate of illness by territory, mainly by state, in a cumulative fashion, but didn't really provide any insights from a business perspective. Yeah. And I think now, as we have to deal with the health crisis, there's also the business of getting back to work and having kind of the same a level of data that we had from a health perspective for the business people to say, here's what's really going on with the illness. What is the real rate of illness? What is it, not just by state, but by county level, is something that we built as part of our data and analytics team to give companies insight, business operators, CEOs, insights into what is going on and where can they make confident decisions around their operations. Obviously, each state
business, everyone looks at those data points in different ways.
Well, they do, and each state has quite a different take on what's happening. And I would say that the generally available information to date that most people had was various sources, and it was really at the statewide level. And what we did was we created a COVID recovery tracker that maps every state across the country, but every county. And as you can see, the illnesses have affected certain counties in a dramatic fashion, but other counties have been relatively unscathed.
Well, on the political spectrum, we see that as well, right? With the governor trying to do something statewide and, counties individually saying, well, we're a little bit different. And then cities within those counties, well, you're different and we're different. Dean, as chief relationship partner, can we bring you in terms of what that means in terms of when you're talking to people and saying, how more data or how we interpret the data can certainly change the way people look at this crisis.
Yeah, absolutely, Claudine. What they want to know is what's happening around me, what's happening around my employees and my locations. right? They really want to understand that because that's going to allow them to make better decisions for their companies moving forward, right? If they have facilities all across the state and some might be in counties that are less healthy than other counties, well, then they're going to want to say, hey, can we pivot here? Can we do anything predictive to do what's best for our organization as we all try to find a recovery?
Yeah, I mean, we aren't cut all from the same cloth in these days. So, Tom, I know you can share this tracker. I mean, and anyone can look at it. Also, I think makes them feel better that they're making a decision that it's not arbitrary. It's not based on, you know, there's so much
Their
emotion
gut.
about, getting back into business, and you want to do it the right way, but you also want to be able to point to something that says, okay, what was wrong? I'll let you pull up this tracker, but tell me how it's also different from obviously all these medical facilities have, and how you worked it into being something different so that the data points are still there, but the interpretation now mirrors maybe, we look at, Johns Hopkins, for example, and it says number of deaths, number of recovered, like it's very obviously focused on simply health. Show me how your tracker is different.
Yeah, I'm happy to share my screen here and pull up the tracker. Here's our COVID
There we go.
tracker. It is on our website, as you mentioned, Claudine. So right off of our armanino.com website, you can get to our tracker. And what we did was, you mentioned John Hopkins and the compare and the contrast. And I think the big thing with some of the other websites out there, they're very cumulative based. So when the disease occurred in February, we started tracking the rate of illnesses, and it doesn't really start to get down to what is actually happening. What is the rate of illness today, i.e., how many cases happened yesterday in the area that I'm most interested in? What is the 3-day, 7-day, and 14-day moving average? But maybe before I get into the specifics of the data, you can quickly see we have a map of the United States. And if you just mouse over any state, you can quickly see what's going on in New York versus New Jersey. Both of those have significantly improved. And you can see the green colors are saying, hey, we are improving on a daily basis. You can go to some other states that maybe haven't started to flatten out or decrease as much, being Illinois here. Quickly look at California and what's going on. But here, as you get into some of the statewide data, I will show you some of the power of this, which is, here's all your states alphabetically, but we can quickly look at what were the cases yesterday by state. Who had the most? California is number one, unfortunately. New York has held that position for many, many days and weeks consistently, and you can see now they're dropping. Additionally, what we have here is what is the 3-day moving average, the 7-day moving average, and the 14-day moving average by state. And you can see New York's 7-day moving average is better than their 14-day moving average, i.e. they are getting healthier. One of the great things about our tracker is if you jump into the state specifically, and I'll pick California because that's where all three of us are today, you can now quickly get down to the counties of California. Again, alphabetical is how they get listed, and you can see specifically county by county what is going on.
I've got to ask you, where do you feed in this data from? Because there has been actually some recent debate about trackers and where the information is coming from, and making sure all these data points come from, sources that people can rely on.
Yeah, absolutely. So we look at multiple sources. Our primary source is usafacts.org. We triangulate that with the other data that is coming out that are more CDC data sources to make sure that this data is accurate. But certainly having kind of real-time information is the big thing. And looking at what is happening yesterday versus what happened last week has been a very good insights from any business perspective, especially any business operator that has multiple locations. One example, Claudine, I like to show here is, just specifically what's going on in the wine country. We love our wine in California. So I like to pick Napa, Sonoma. Let's pick Sonoma. And we love the Pinots from Santa Barbara. So let's go up here, and right here we have our three major wine categories, and quickly we can see what is going on in Napa. How many cases have they had?
Mm-hmm.
Relatively low level in Napa versus Santa Barbara, Sonoma, and you can see. And as you come over to our tracker, you can mouse over the county specifically and get additional data. So
And so
in one,
those are all really good ways to kind of get a sense of where we've been and sort of where we're going, depending on how things change. And certainly the opening up does change the ability to kind of predict which way it's going. Dean, are you getting a good feedback from when people are using this? I mean, it is fairly,
Oh
I
yeah.
went through it and it is a fairly easy, user friendly, which is important depending on
Yeah.
how technically people are savvy to go
I
through
would
it.
say very, very easy to use, Claudine. And we're hearing back from CEOs of organizations, CEOs of nonprofits, associations of professional organizations, and they're all jumping into this thing and diving in because it is becoming a helpful tool.
Is
And
there,
it's
yeah,
free and it's local data.
and local is important, but is there some concern for you guys as well that part of the challenge for businesses, I think, is not only seeing where we've been, which is bad, and where we're going, which tends to be good, but how our behavior can change the numbers that we're seeing so that they continue to trend in the downward direction. And that's the complicated part, I think, of knowing, okay, well, this is good, it's going here, right? Bay Area has lower numbers of cases, but that's because we've been sheltering for so long. How will that change? And how do you make a business decision based on all these factors? This is one part, but it is only one part of the pie.
yeah, absolutely. I think there's many factors to consider, as I mentioned. And so, having real-time information is a definite value to any business owner, business operator, to make decisions. I don't think this is the only source of information that they look at. Obviously, anybody operating businesses, any of our clients that we're talking to, the health and well-being of their employees, what is going on with schools and school
Mm-hmm.
openings is going to dictate employees coming back, or still working at home. So there's lots of factors to consider
Do you get the sense
when.
that people were overwhelmed? I mean, this helps kind of focus where we're looking at. And do you get the sense that business owners were just feeling like they didn't know how to navigate through all the numbers and all the sources?
Yeah, absolutely. I think the sources of data that were presented to them were very much from a medical perspective, very much from a cumulative perspective. And business people like to look at trends. They like to look at moving averages. They like to look at, more of the business analytics behind what's going on to derive and make decisions.
Yeah.
I'll
That
mention.
they have a lot of locations as well. So, if they get so much from San Francisco in the Bay Area, but they have a operation in Nevada or Missouri, then it becomes the other challenge of trying to get over to Nevada, Missouri, and figuring out what they're saying over there.
Well, that's absolutely right. In fact, I talked to a CFO yesterday that has 57 locations across the country, and every location is different. The details by location change, and so having the information, working with a major franchisor that has 2,400 locations across the country, and which franchisees are relatively unscathed. Like in this case, like Napa, you could say, hey, they're pretty healthy compared to maybe some other counties like a Los
Mm-hmm.
Angeles. And what is the strategy for our franchisees in those locations versus maybe a county that clearly has a lot more cases? And then what is the strategy for our business, as well as getting our employees back to work?
So I'm curious, because you guys are a consulting firm, you can give people this information, you can, watch the numbers. Are they asking you for the green light? And how comfortable do you feel giving someone the green light to say, well, we can look at these same numbers and we know it's trending in the right direction, but you know these these aren't just by the numbers. Well, yes, you're growing, you have capital, you have the ability to expand, you have you know, they're in a different place now as well.
Yeah, I think where we're getting the most requests today on helping a client think through and determine their strategy of going back to work is quite a bit around the employee communication. So how does the employee handbook need to change? What are the new policies and procedures? Obviously, cleaning and sanitizing office space,
Yeah.
seating distance is important. We are also creating an application. While this one runs on our website, we will have another application that is a mobile-based application that our employees can check in and check out employees. You can record temperature readings. You can record, maybe part of the strategy is, hey, we're going to have 25% of our employees come back to the office at any one time. And so we have an ability to track that and the reporting behind it to make sure that the teams are following the right employee policies and procedures. And so, I think what we're doing is not just the COVID recovery tracker. I think this is a very great piece of data and insights. It's really the same data that you mentioned that other sites have, Claudine, but it's presented in a way that it brings it to life. It's easy to use. It's easy to glean insights, but it's definitely not the only thing.
Yeah.
The
how
business.
hard was it? Let me ask you really quickly, how hard was this to put together?
Well, we have a whole data and analytics team. This is what we do for clients, whether we're using external data or the internal data that a business generates. We help them bring data and insights to life. We do this every day for our clients. So on a scale of easy or hard, I would say this was fairly easy.
Really? Oh, well, that's great. Dean, I in terms of the relationships with people, I feel like people need a little bit more comfort as well as they navigate. I don't know if that's just me.
No,
But
you're
I think
absolutely
I
right.
think we
You're
need.
absolutely right now. Anybody wants, in times of crisis, they always say run to the helpers, right? And this was our way to be able to help our larger community, right? Give some insight that is helpful for people to make decisions and just feel better, even about just say it on a consumer level. Am I going to go back to the gym? Well, let me see the health in my area and say, am I going to go back to my gym? If health is looking good in my area, I feel a lot better about that decision.
Yeah, I mean, because I would imagine you guys are CPAs as well. The books aren't looking great for a lot of people right now, unfortunately.
Yeah. Mm-hmm.
Well, and there's a lot of uncertainty around that. And so, what companies are focused on is cash management, liquidity. Am I going to be able to make it through this? How many of my employees should I retain? How many should I furlough? And do I have to lay off any? Those were decisions that, every company is going through. Is my relationship with my bank strong? Can I have access to liquidity? These are all decisions that companies have gone through. Did I and do I have the ability to have a remote workforce that's efficient and effective? And now we're transitioning to a couple key and important things in this new environment, which is, what is my work strategy? How many people can work at home versus back in the office? Things won't go back to normal. There will be a new normal, but what is that new normal? How do we balance that? And quite honestly, there's another curve that, America now needs to flatten, which is the unemployment curve. And so how do we get businesses back up and running safely, responsibly, but effectively? And so, those are the things that are weighing on CEOs and business operators' minds. And that's what we're trying to help them think through. Try to be a good partner to them and work through these issues that all these businesses are facing.
These consulting companies like Armanino have to also rethink their industry. And that's what I think this COVID tracker is, right? Rethinking how you can help people in ways that you didn't need to necessarily help them in before. And when they're looking around, that it requires you guys to be creative and on your toes as well, just because you're consulting in a pandemic, which is a first for us all.
Mm-hmm. Yeah, absolutely. Innovation's at an all-time high. Quite honestly, working with our clients in the past, we prided ourselves on being face-to-face. and being right alongside with our clients. One of the things that we've recently done is launch technology that virtualizes the conference room. We have a virtual whiteboard. We can put virtual Post-it stickers up. We can rearrange them on the fly. And so, some of the new cloud technology, we've emerged to say, this is how we want to work with you, client. This is how effectively we can be, and how we can collaborate with you. Even though we're not in the same room with you, we can give you that same effect. And that actually has brought a lot of comfort to our clients.
Yeah, I think
I would just add that, Claudine, I would just add that, when you talk to our customers, every time it's coming from a position of help, right? From our clients, and you hear their pains and you hear their struggles, and not all of them have a data and analytics team, right? They don't have those resources to have people that are data scientists and programmers on deck to answer their problems. But being able to hear the biggest challenges that they're facing really allows us to say, maybe we have a solution for that, or maybe we can help. And that's what our data analytics.
I guess, are you guys feeling optimistic at this point? I mean, it's when you talk about the economic curve, it looks like a long, tough road ahead. So, are you feeling optimism? Are you feeling caution? Are you feeling, what is the generalized feeling of where you're feeling and where your clients are feeling these days?
Well, I'm definitely an optimist at all times. So I try to keep that going. But I've spent more time talking to our CEO clients and our CFO clients over the last 2 months than any other activity that I've done. And what I would say is it's all over the board, Claudine. We've had some businesses that were in the restaurant food service area that closed down all their locations, dramatically hit when the virus hit, and are dying to kind of reopen and reemerge. But in the meantime, they've done things like, created apps where users can still order and come in and pick up. And so they've had to innovate and has brought really good momentum and emotion to them. We've had other clients that are in the healthcare, life sciences, biotech space that this has been really a boom time for them. And the question is, how do we, kind of keep up with everything that's going on? So I think, really the type of recovery that we're going to see is what I call a LUV recovery. It's not going to be a V recovery for everybody.
Yep.
It's not going to be an L recovery for everybody. And some people will experience a U recovery. So we're going to have all three types of recoveries for industries and for businesses. And I think the question for any business owner is, what type of recovery should I expect for my business and my industry? And how do I manage through that time of uncertainty?
Yeah. It is a complicated and difficult time. And certainly we want these businesses to succeed and to expand so that we are allowed out of our houses. They're there. That I think is the biggest concern that the world will go back to, is we'll be missing a lot of businesses that did not survive or survived in a different form and fashion. And that will be very difficult to see. So Tom Mescal and Dean Piombo, it was so great to talk to you. I think the COVID tracker is a very, very interesting thing to play around with and look at and really get a perspective as this moving target that is this pandemic continues to to dodge and weave. It allows us to dodge and weave with it. So I appreciate your time and the discussion.
Well, thank you very much.
Thank you.
And for more interviews, you can, of course, go to coronavirusnow.com. Thanks so much for joining us.